Being a nurse at New York-Presbyterian means I have the opportunity to have so many resources available to me. It gives me the chance to serve our patients the best I can.
I grew up in this neighborhood, and they've been serving the community for many, many years. And I do try to give everybody the best care that we can, because I want them to be like, oh, you have to go. I was at the Allen, we got great care. You know, they're one of the best in the city. They really took care of us.
It takes a special person, I always say, to be a nurse or to work in a hospital. Not everybody can do it. You have to be able to sympathize, empathize, be very caring, even on days that you're tired and maybe you don't really want to be here, but the patient's here. So you go in and you treat them, and you go in with a smile, and you treat them as if they're one of your own, as if they're one of your family members, to give them the best possible stay that you can.
I love to please everybody, the doctors especially. If they're happy, I believe they're happy, everybody will be happy. And if they're satisfied with the nurses, everything will work well.
But the nurses work really hard on the unit, so any way I can help, I try.
I love the people that I work with. I love that I get to be a part of a team that is part of the most intimate moments of our patients' lives.
I love being a nurse. I love what nursing is, what it means. I love to help others. It's everything and more. I couldn't ask for a better job.
You have to love what you do. And if you love what you do, you can provide good service, anything that the patient would need, your co-workers and everything. You become passionate of what you do. And you can serve patients much better.
Well, I'm support staff, but for me, I just like helping people. I like to try to make a difference in their day. I started out here a long time ago and wasn't planning on staying, but I have stayed this long, and I just like what I do. Every day is a different day for me.
I think that's what makes this award so special, is that our coworkers did nominate us, and that they did say, you know what, you're so good at what you do. We want to recognize you. We want to show you that you do such a great job. We want to tell you. We want the whole hospital to know.
Coming from my coworkers, I feel like they do see stuff that I do, and they do know that I do things.
The only thing that would be more meaningful than getting nominated by our coworkers would be getting nominated by our patients. I mean, we show up for our patients and we show up for our coworkers, so yeah, it's definitely meaningful to be nominated.
It's really great to have your coworkers appreciate what you're doing, and you become example. And I think for me, I'm just a representation of my unit. Everybody does good job in my unit, and we all work together as a team.
Yeah. We had one patient who was really nervous being in the hospital, so I was talking to him while he was at the desk waiting for transport, and I was like, relax, you know, I've been a patient, it is nerve-wracking, you don't know what's really going on, don't worry about it. He actually was transferred to another floor, but on the day of discharge, he came back to say goodbye, you know, to thank us and say thank you for talking to me. So that's, you know, very satisfying to say that I touched somebody or had some kind of connection like that.